Hello and welcome to Wellness Wednesday. I'm James Currie with the Communication Department, and I've got two other people here with me. I've got Dr. Rendi Murphree. She's the Director of Disease Surveillance. God, I guess it's just so much to say. Let's just call you the COVID czar, because everybody knows your face. And we've got Chastity Wallace, and she is a wellness greeter. So everyone should know her face if they come in the door here at our main building on Bayou Street. So, hey, guess what we're talking about today? Something that never went away, which is COVID, right? It never went away. Right. It didn't go to sleep. It didn't go dormant. It's there. So, Dr. Murphree, just tell us where we are right now with it.
Well, things are looking pretty good. We've got really low case counts, which is good news. You know, we had enjoyed for a couple of months low case counts, low percent positive, low hospitalizations, low number of deaths. We're seeing cases and percent positive tick up a little bit. I'll talk a little bit more about that after we talk to Chastity. But overall, we're in a pretty good space. But we're not out of the woods yet. And despite having vaccination and having treatment and really being in a much better place than we have been for more than 2 years that we've been dealing with this pandemic. We still, at the Mobile County Health Department, at all of our family health clinical sites, we are still requiring masks for all of our employees and all of our customers, clients, patients that are coming into our clinical settings. And so I wanted to talk with Chastity about that a little bit, because in her role as a customer service wellness greeter, she is the first sunny, happy face that people see when they come to our downtown Keeler location. And she hears it. She hears it all. So Chastity, tell us about your experience. Really, reminding people that in a clinical setting, we still want to see, people wearing masks and distancing indoors.
Well, great. And hello to you both, Mr. Currie and Dr. Rendi Murphree. Well, what I can tell you is that the protection of our community is very important. Even though that you come into the health department, our main focus is your safety, not just, a self by yourself, but as a whole. We're trying to protect our community and also to keep our healthcare workers also protected in order for us to stay open. So our normal process here at the health department will be, as you enter the building, you do have to get your temp. And also with getting your temp, if you do not have a mask, we are here to provide you with a mask. Right. That's what our main goal is here at the health department.
Yeah, and I've heard that sometimes people maybe get a little bit upset about that.
I know. Yeah, we do. Yes, we do have that a lot. We have people that are upset because their main thing is that they're vaccinated, they're boosted. Why should I have to wear a mask? And we tell them that's great. We're happy that you have made that step to get vaccinated, but please keep in mind that you can also still get COVID.
That's right. And also, they know their vaccine status, right? But we don't require proof of vaccination for anyone coming into our clinic. So again, as you said, it's not just about protecting self, it's about protecting community, right? Correct. There may be other people in the waiting room with them that haven't been vaccinated. And maybe if they caught COVID, it could be very severe for them. So again, it's just trying to help people understand that, hey, there may be a day where we no longer have to ask for people to wear masks in healthcare settings, but we're not quite there yet, right? And
that is correct. Not yet. Not yet.
Well, it seems like your disposition and everything that you've learned talking with people at the public probably gives you a really good understanding of people's concerns and fears and their beliefs. Are there other things that you want to share with us that you encounter when you're, greeting people to come into the facility?
Well, also they're concerned about their health. You have people that's already had COVID, and also the long term of COVID. They talk about that. It's something that they fear. It's something they don't want COVID. They do everything possible. We have customers and patients that come in and they share their experience. And it's some sad ones, very sad. It makes you tear up.
Yeah.
So that's why we stress that we do have, the option. You have the option. It's not forcible, but we do encourage that you do get vaccinated. And
Right.
also wear your mask, wash your hands, use your sanitize. So it's just a lot of different things that not only impact us, just self, but everyone. It's the summertime, things are heating up. It's time for fun, it's time for the beach, but we also want to be safe.
Right. And so, where individuals have, they can make decisions for themselves to get vaccinated, to distance, to wear a mask. We at the health department are really trying to protect our customers and our clients and our patients.
Correct.
And then also, as you mentioned, and we maybe can elaborate on this a little bit, we want to protect our healthcare workers, right? Because we want our clinics to stay open. We want to continue providing those critical services to our clients, customers, and patients, and keeping our clinics open is only doable if we can protect our health workforce.
I totally agree.
Yeah,
it's very important.
Great. Well, Chastity, we're just so thankful to you for the job that you do out front. And, lots of people know Miss Chastity and Miss Gertrude and others that work at the front desk. And I understand that you guys have received recognition for that activity. Is that right? We want to congratulate.
Yes, ma'am. We sure
celebrate.
have. It was a surprise.
Yeah. So the greeters and the security staff, and I don't know all of their names, Chastity, but if you want to share all of their names, please do. But they were recognized by the agency. They received a Team GEM award for the first quarter of 2022, and that GEM stands for Going the Extra Mile. So we really thank you all. And Chastity, while you're on, why don't you tell us the others that work there that I don't know personally?
Okay. So we have Miss Gertrude. She is a security guard here at the health department. She works first half of the shift. The second half of the shift will be Mr. Perkins. He works in the evening to close here at the health department. And we deal with everyone that enters this location here at Keeler. That's our job. That's what we're here for. And we do everything possible to help each individual, no matter how easy it is, no matter how hard it is. That's what we're here for. Great. And we love our job. We love helping people.
That's great. I know several people who say that they could take a shorter route from the parking lot to their office, but they go through that main entrance so that they can get the morning cheer every day. So
yeah, the greeting.
Yeah, that speaks a lot. People like to, even our employees appreciate that good greeting.
Now we'll be right back here with just Dr. Murphree and myself, and we'll talk a little bit more about COVID. So just hold on, stick around for just a moment. Well, welcome back to Wellness Wednesday. If you were watching here online, it was just seamless. There's no pause, no break or anything. But so, hey, Dr. Rendi, I went to the grocery store and had a mask on, and I felt like I just landed from some other planet. So, I mean, yeah, we're still wearing masks, right? Yeah, like we just talked about.
Yeah, we found out very early in the pandemic that we would go through waves, right? The cases would go through waves, prevention measures would follow those waves. And so we try to layer on and layer off prevention measures as appropriate with what's happening in our community. So for the past 2-3 months, we've been enjoying a really low level of COVID-19 in our community. A very low percentage of people who get tested for COVID are actually positive, very low number of hospitalizations and deaths. These are all really good things. But we still want to base our decisions about prevention measures based on our own sort of personal health situation and the risk of the environment that we're going into, right? So if you're vaccinated and you're boosted and you're a healthy person, you are doing everything you can to protect yourself, right? For your biological self. But then you have to think about the physical environment that you're putting yourself into, right? So if you're at an indoor setting, gathering lots of people who don't wear masks, maybe you don't know if they're vaccinated or not, like that raises your risk of transmission, even though you've protected your biological self, right? So we've been encouraging people in this very low transmission period, do something outdoors, go to an outdoor concert, do something you haven't done in a couple of years, maybe go to a movie, sit away from people, right? But if you go with your family member who are all vaccinated, you should be fine.
So how is the invention of the invisible mask that you can wear at the beach going?
Yeah, that's not a thing. That is not a thing.
No.
We are starting to see, though, cases rise nationally, and there has been some press lately where, CDC has said, probably a third or maybe 40, maybe even 50% of Americans should be asking if they're indoors. And these are people that are older, have underlying medical conditions, maybe aren't fully vaccinated and not fully boosted, that when they're in an indoor setting, they really should think about wearing a mask to protect themselves, because we know that people who get vaccinated can still get COVID. And so you just have to really, take care of yourself and really sort of think about the risk that you're putting yourself into when you go out into the public. I'm like you. I'm the only one with a mask on if I go into the grocery store.
I know. I just, I felt like,
it's like the worst kind of peer pressure, right? It's like I feel a little bit embarrassed, right? Because my husband and I feel embarrassed for him that we're wearing a mask and people are looking at us like we're the aliens, right? And but we've made that decision for ourselves that if we're in an environment where we're indoors and we don't know the vaccination status, it's not going to hurt us to don a mask. We've been doing it for 2 years now. We can adapt.
Right. It is. It's not. It's not, being selfish or anything, it's, we say it's personal choice and things like that, but, we're still on the mitigation factor of wanting to protect. So what's the difference? I mean, it's not going to hurt, to continue to do it. So
I think the important thing is that by now, in the beginning, we didn't have treatment, we didn't have vaccine, we didn't understand transmission dynamics. And we've seen different variants come and go, but, I think at this point, like public health, we just recognize that people need to make the best decision for themselves. And we'll continue to provide credible, factual, real-time information about what's going on in the community. And then, at that point, turn it over to the individual. The same thing we do with, public health is always a proponent for smoking cessation, for exercise, for a balanced diet, for weight loss, right? Maintaining a healthy weight. And those things are, they're not always easy. They're not easy. They're hard, but we still gently remind people, right? The things to do to be the healthiest version of themselves. And so, that's our job, and that's what we'll continue to do. But I do want to talk a little bit, though, about schools ending and probably over for most people, unless you are attending summer school. But we're moving into summer camps and all kinds of summer camps, right? Camps about sports,
vacation Bible school,
church, like all kinds of things. And that young population are the ones that have the least amount of vaccination, right? Because right now we only have a vaccine authorized for 5 to 17-year-olds. And so that is the lowest, that group has the lowest vaccination rates of anyone. And so just like last summer, we're still going to be in a situation where if COVID gets into some of those camps, it could really, fly through and infect a lot of children. So just parents, just be mindful of that. It's not too late to get your kids vaccinated. Very safe and effective vaccine. We give it 5 days a week for free, walk in, no appointment necessary at the festival center. But summer activities may tend to bring us together. As you said, there's really no mask wearing at the beach or at the lake or on the river or in the bay. So we just want people, again, just to remember to kind of think about your level of risk when you're going into some of those situations.
So you just talked about it a second ago. So before we go, you could probably point with your right hand out of your window and point west to point to the festival center. So
that's right.
Let's tell people about that option for the festival center and what we're doing there. So fill them in.
Yeah, it's really great. You know, we are happy to be in that location. It's at the corner of
Mont Lamar
Mont and Airport.
Airport. Yes.
Thank you. In the festival center, we're in the old Lifeway building. I think it used to be a bookstore, a faith-based bookstore. And so we've been there for about 8-9 months now. It's a really great space, plenty of parking. We do walk-in vaccinations, first dose, second dose, first booster, second booster. No appointment necessary. We have Moderna and Pfizer there. We're out of J&J vaccine, but we still have plenty of Moderna and Pfizer. And we also do appointments for testing. So we can still do, rapid testing, get results while you wait. You go to appointments.mch.org to get a appointment, and we can test you there. And we are getting, it's kind of cool because we're getting traffic from the Carnival Ecstasy there coming in, people who have to be tested within 24 to 48 hours. We're seeing quite a few cruise passengers come to get tested before they board the Carnival ship out of Ecstasy. We also now have moved religious exemptions out there. So if you have a religious exemption against, or a religious belief that against childhood vaccinations that are required by the state of Alabama, you must go in person to a health department. It could be any health department, but for the Mobile County Health Department, our location is at the Festival Center where we're doing those religious exemptions.
Yes, thank you for, just people maybe drive by there and they're like, hey, that says Mobile County Health Department. What are they doing in a shopping center? So that's why we're there. I mean, we have to go to where people are.
Yeah. And last year, this time when we first, started looking into a new place, remember we had to vacate the location at the mall and we were looking for something else. And really our political leaders and our community leaders really encouraged us to have something west of the interstate, because most of our stuff in the middle of the county is downtown. And so we're really happy to have this more centralized location at the corner of Airport and Mont Lamar. It's just about a mile or so off the interstate. So very centrally located. Like I said, plenty of parking. It's a really nice space.
Yeah. As far as convenience, we couldn't find two bigger major thoroughfares than 65 and Airport. So we're in a great location. So anything else you want to talk about? I know we've talked about COVID so much. It is kind of cliche to still talk about some of it, but again, I think we can both agree and shake our heads, let's not let our guards down about it. I mean, it's still around.
It is. So be safe, keep informed, stay informed. Call us if you have questions. We are happy to answer questions about vaccine or not to vaccinate, booster or not to boost, timing of boosters, that sort of thing. We encourage everybody to get vaccinated, but talk to your doctor, talk to your pediatrician, talk to your pharmacist, other people that you trust about it. And hey, have a safe summer, right? Swimmer safety, barbecue safety, fireworks safety, sunburn safety, like all those things that we like to remind people to do just to have a safe and healthy summer. I hope it's a good one for everyone.
Absolutely. And I as well. Dr. Murphree, thank you for being on Wellness Wednesday, and thank you for your time.
My pleasure. Bye.